You can prepare for breastfeeding during pregnancy to make it so much easier for yourself once baby's here, and I'm going to show you how. I call this building your breastfeeding safety net. It's essentially creating a plan for how to get off to a successful start with breastfeeding, especially that first week, and what to do if things don't really go according to plan or the way that you want them to go, so that you're not overwhelmed with decision fatigue and panic postpartum when you're trying to recover. So, first thing is educating yourself. You really can't skip this part. You've got to have some baseline understanding of how milk production works, how to bring in a strong supply, and how to logistically feed your baby, how to bring them to their breast to nurse. Like, literally, what do you do? What do you do if they need bottles? What do you do? Just tell me what to do. So, for educate yourself piece, you've got your hospital breastfeeding classes. There's lots of online options for you. I have an online course called Simple Start where I just simply walk through that first week with you and tell you day by day for that day, what do you do? What can you expect? How will you feel? And what to do if XYZ. You can grab a link to that in the show notes. Second thing you're going to want to do is go ahead and during pregnancy, make some decisions. While you have time to think and research and consider what matters to you, go ahead and make some decisions specifically on what you will do if baby needs supplementation. Supplementation is if baby needs to be fed with anything or any other way other than the breast with you. So you're going to want to decide if baby needs to be supplemented, what are they going to get? The best thing for them to get is your expressed breast milk. Second best thing would be donor breast milk. Third best thing would be formula. So pick your priorities. Typically, that's what's recommended is 1, 2, 3 in that order. And then if you're going to need formula, go ahead and choose which formula will I use. A lot of times there's not a medical necessity to use one specific formula over another. So it's up to the parents to choose one that they want to give their baby. So look at the ingredients, look at where the formula is made, look at whatever matters to you about the formula. Look at all of your options and figure out which formula you might use. You need to decide if you're going to use powder-based formula or ready-made, the liquid kind, because the ready-made formula that's liquid is sterile versus the powdered is not. You have to prepare it with water. The ready-made is a little more expensive, but some parents prefer the simplicity of it and just knowing that it's sterile versus powdered formula can be less expensive. Either one are fine options. If you've then chosen powdered formula, you need to then also go ahead and familiarize yourself with how do I safely prepare formula. I'll link for you down below some recommendations from the CDC here in the US on how to prepare infant formula. When you're preparing it in the first 2 months of baby's life, you are going to want to make sure that you take extra care to protect against any bacterial contamination. So you can look at that yourself later. I'll link it below. Anytime you do powdered formula, you always want to measure the water first and then the powder. So make all those decisions now when you have the time and mental capacity to do. And last thing in that regard is you're going to want to think about, okay, now I've chosen a formula. I've chosen powdered or liquid. I know how to prepare it safely if I were to need to do it. Now, where would I buy that formula? That way, if it's 2 a.m. and you're struggling and you need to go have your husband run to the 24-hour Walgreens down the street, he knows that he can get it there. Or are you going to have to order a same-day pickup for Target? You need to figure out where can you buy this formula that you plan to use if you need it. Having all this figured out ahead of time is so great. The second piece of making decisions about supplementation is how are you going to give it to your baby? Of course, there's always bottles. But there's other ways too, especially in the early days. You can use a syringe, a cup, a spoon. You can use a supplemental nursing system, which is like a feeding tube at the breast. So look into all your options and what you might prefer to do. And then if you are going to use bottles, a lot of parents end up using them at some point. You're going to want to figure out which kind of bottle am I going to use? What nipple shape is recommended? What flow rate of the bottle is ideal? These questions can be asked to your lactation provider. If you're able to meet with one before baby's here, that's excellent. They can give you their professional recommendations. I also have a bottles and pumping guide within my Made to Mother Milk Circle. It's an online community that I have of mothers who are pregnant, preparing to breastfeed. It's got the Simple Start course in there and all kinds of guides. I've got my guide on bottles and pumping in there too. So there are resources out there for you. Next way to prepare is to go ahead and practice hand expression. Hand expression is using your hands to express milk from your body. So we do have electric breast pumps that we can use and even manual pumps that we can use, but just using our hands themselves is so great in those first few days, especially when colostrum, your first milk, is so small in quantity and it's also thick and sticky. It can get lost in big pump contraptions. So using your hands is a really great way to bring that milk out, and it provides really good stimulation to your breast, which is part of how we tell our body to make milk. So hand expression is a really key tool. You can also use it if at some point you get engorged or your pump dies and you need to know how to express milk with your own hands. So you can even start practicing that now. It typically recommended from 37 weeks onward is safe to do so. Just get clearance from your OB or midwife before you start. And yes, you can express colostrum during pregnancy and freeze it and save it in case your baby needs supplementation later. Fourth thing, go ahead and organize some basic supplies that you might want on hand for your breastfeeding experience. This can be simple, like a little cart that you put by your bed in your bedroom or the chair in the nursery or downstairs by the couch. It might include things like a burp cloth, snacks, a water bottle, nipple butter, a breastfeeding pillow if you want one, a book light. I love a book light. Your earphones in case you want to listen to anything. So just having a little station set up for you can be really comforting and feel really nice when you get home and you're feeding baby 8 to 12 times a day. One more thing with organizing your supplies is getting your pump. Go ahead and order your pump during pregnancy so you have one on hand. Pick a really strong pump, like a Spectra is a tried and true pump, the S1 or S2. The S1 has a battery, which is nice. There are a lot of other great models out there, but you do want a pump that is strong to help bring in your milk supply over those first 12 weeks. I wouldn't use a wearable very often, the ones that just sit in your bra. They can work for some women, but for a lot of women, they're not strong enough. So just use caution with that. And then go ahead and measure your starting flange size. So measure the width of your nipple at the tip and the base. That should give you a measurement in millimeters. And that is generally where you're probably going to start off with a pump flange if you need to pump in those early days and weeks postpartum. Now the size can change because our bodies change a lot just during birth and those first days postpartum, but it can give you a jumping off point because a lot of women are not a 21 or 24 millimeter, which is what comes with standard pump flanges these days. Fifth thing, we're almost there, is make a plan for what you're going to do if you're separated from your baby right after birth. Ideally, you'll be brought skin to skin with baby and be together and have as much time together as possible to get feeding off to a good start because babies eat really often and you need frequent milk removal to bring your milk in and for a baby to continue doing well. But in some cases, there are medical reasons why mom and baby are separated. Having a plan for what you'll do if that happens can be really, honestly, game changing. Once baby's here, it takes away the freak out moment of, oh my gosh, I didn't think my baby would have to go to the NICU. Now what do I do? Am I not going to be able to breastfeed? You definitely can. It's going to take some shifting of perspective and some steps to get there. But the biggest thing is you need to protect your milk supply and then obviously make sure baby's getting fed. So creating a plan for how to do that is really important. I'll dive into that in another video soon. Embrace help and build your support team. Writing down who is going to be there to support you postpartum and specifically with breastfeeding is really helpful. This can include who are you going to call for lactation help? Who is going to be on speed dial to answer your questions? Like I mentioned earlier, meeting with a lactation consultant or a lactation professional before baby's here is so nice because you can go ahead and start that relationship, get all the history taking out of the way, get each other's numbers, and they're boom on speed dial once baby's here. So having that contact ready is great. Think about who you want to be your pediatrician. And ideally picking someone who's breastfeeding friendly, who will encourage your breastfeeding experience, picking someone who aligns with your values in terms of how you want to care for your baby. You might even want to go ahead and figure out, are there any breastfeeding support groups in the area? Are there, and if I were to need anything like bodywork, like infant chiropractic, or even a tongue tie release provider, do I know of who in the area does those things? You can take your time now to do some research, look on the mom groups, even ask your lactation consultant who's good in the area, just so you know who's around to help you if you were to need it. And last and final thing, make a little plan for yourself of how are you going to recover after birth. You're going to be taking care of yourself and your body that's changed so much. And you're also going to be taking care of this new little one. So, how are you going to balance that? How are you going to make sure that you're eating and drinking regularly? What supplements are you going to be taking to support yourself postpartum? How will you maximize sleep while still protecting milk supply and being there for your little one? How are you going to get outside and see the sunshine and touch some grass every day? Move your body a little bit every day, even if it's just walking or stretching. Having that can really protect your mental health in the postpartum season, and figuring out who is going to help you take care of you. Is your partner going to be around? Do you have a mom, a mother-in-law, a sister, a friend, a neighbor, someone who can be there for you? How can you recover? So all these things give us a framework of how can we succeed in postpartum? And by succeed, I mean have a joyful, supported, not overwhelmingly stressful experience as best we can. Having some of this stuff planned out ahead of time of what I'm going to do if XYZ, what am I going to choose for XYZ, it can be so helpful. If you're currently pregnant and you just watch this whole thing, I want you to be encouraged that you have already taken a big step in preparing for breastfeeding just by thinking about how can I prepare for breastfeeding. I'm Sarah. I'm a certified PA and lactation counselor. I'm also a mom of 3 and owner of Made to Mother Lactation, and I'm so excited to walk with you through this journey of preparing to breastfeed your little one.